Yes. So thank you again for joining us today. Today's session is Advanced Directives. What are those? With Human Development and Relationships faculty educator Jackie Carattini. I'll hand it off to Jackie for her introduction and thank you.
Thanks, Miss Heather. So welcome everybody. My name is Jackie Carattini. I am a Human Development and Relationships educator located in Wood County, so the very center of the state. And today we're going to be talking about advanced directives. So let's just take a minute before we start. I know that the idea of talking about both death and thinking about our mortality is sometimes a really big and heavy topic, right? A lot of times, if you've ever tried to have this conversation with your loved ones, they, sometimes their eyes get really big, like, oh, are you not telling me something? Or they think there's like a big secret diagnosis or something has changed. But the idea that, we really don't talk about anything surrounding death in our culture. And we don't have a lot of experience talking about it, right? So this might be the first time you have some of these conversations. We also, really know that everybody's in a different place. So you might have experienced something in the last year or two, or even having these conversations brings up memories or ideas, and it can be rather emotional. So I do encourage you, when you do think about this and start having some of these conversations, to give yourself grace, right? So just take a minute. If you do feel your anxiety rising, just take a few slow, deep breaths, and know that as you do that, you'll feel your shoulders just kind of drop. And you don't want to hold on to that tension. And then know that when you have conversations with your family, your friends, your loved ones around not only this topic of advanced directives, but anything relating to death, to give them that grace too, right? So as you have these conversations, you might want to say that to them as well. Like, I recognize this is uncomfortable, but let's just take a few minutes, take a few, slow deep breaths, and we can pause at any time if we need to pause, and then we'll just start. So I encourage you to give yourself that grace today if it happens to you, but also as you begin to think about these things and share them with your loved ones, give them that grace as well. So our topic of today is advanced directives. And if you've been to the doctor's office, I'm going to go in the last 5 years. So even pre-COVID, I can almost guarantee that every single one of you has been asked the question, do you have your advanced directive forms, right? Nods of heads. Yes. Yeah. So they're pretty vigilant. This is something that most healthcare providers have been really vigilant on. I'd say, like I said, probably in the last 5 years. But a lot of times people, I don't know about if you're like anyone in my family, but what does everybody say? Yeah, right. And they don't necessarily fill them out, or they haven't done it, but you want to just like get through to the next person, right? You don't want to be held up any longer. Or they'll say, here you go, and they'll give you the forms, and then nobody's ever done anything with them. They're still sitting in your desk drawer. Anybody, that's you, right? So it's one of those things that we've all heard about it, but we haven't necessarily taken the steps to get anywhere. So there's also tons of language, right? All these different acronyms and words. So, it might be advanced directives, it might be living wills, powers of attorney, both for healthcare and finance, a post. Some parts of Wisconsin have something called a post, P-O-L-S-T, and a lot of times we're like, this makes my head spin, right? I don't even know what's the difference with all of these different pieces. So we're going to have a conversation today around a lot of these things, and we'll explain them. But as we start, keep in mind, they all have the same goal, right? They're all a little bit different, but they all have the exact same goal. And that is to help you, direct your healthcare if you are a loved one is unable to communicate their wishes, right? So that's the purpose of the advanced directives. All the different forms that are included is to help you tell someone what your wishes are, given the chance that you're not able to communicate it at that time. So, by discussing this with your loved ones, your family, and your friends, you're able to ensure that your wishes around end of life, really will be carried out. And also the idea that, especially here in Wisconsin, and I know some of you are other locations right now, but pretty much everything I'm going to say today is couched around Wisconsin law. So I'll actually bring up some of the codes today because it is. So these are legal binding documents. They do need to be specific to the state that you're in. So, and I'm going to use Darlene because she was just sharing with us. She's currently in Arizona, so she can use her Wisconsin forms, but she might need to check with Arizona to see if they have different regulations. So if you're someone that goes back and forth between different locations, I encourage you to look that up as well. Most of the time they're fairly similar, but there are going to be some things I'll say today that are very specific to Wisconsin. So in Wisconsin, the law has decided three main categories of advanced directives. So the first one is something called the Wisconsin Living Will, or you might also see it called the Declaration to Healthcare Professionals, okay? The second one is the Power of Attorney for Healthcare, and the third is the Power of Attorney for Finance. I'm not going to go too much into the finance one today, but we will mention it because a lot of times when people carry out the first two, they want to take care of the third right away at the same time. You don't have to. Don't feel that you pressured that you have to, because they are separate and it's not required to do them. The reason that we talk about this is that anyone and everyone over the age of 18 really can benefit from, healthcare advanced planning. So this idea that, really out sharing what your wishes are, and then we'll talk about this today, coming back to them periodically. So if we did this at 18, then, making sure that we come back and update it as our life changes, right? And we'll talk about that a little bit later too. One of the reasons that it's so important that we do this, can someone mute everybody for me, please? That in Wisconsin, Wisconsin is not what's called a next of kin state, or also there's other terms for it, but what that means is that in Wisconsin, they do not let family members make decisions for someone who's incapacitated. So as a general rule, a spouse cannot make decisions for a spouse, parents cannot make decisions for their adult children, and so on and so forth. There are some exceptions, so things around hospice and emergency room, those kind of things. But as a general rule, we are not a next of kin state. So before anyone jumps on me and says, "Oh, I have a different experience," I will say that there are some exceptions to that. I know some healthcare systems really try as a goal to work with the family as much as they can. So, it might be the social worker or, different people on the team might work with the family to ask them what their wishes are. But do know that legally in Wisconsin, they do not have to ask the family members. They're not required to do that. And ultimately, it is up to the physician or the team to make those decisions unless you have these forms filled out. So that is why it's so vital here to make sure you do that. I debated today bringing up COVID or not, but I know just in the, my small world of family and friends, it was kind of a rude awakening for a lot of people in the last couple of years, because this is where they first heard this rule, right? So providers were making decisions for them, to be intubated and different things, whether it agreed with the family or not, if they didn't have something in place. They didn't have those advanced directives in place, and people were really upset by it. And so I don't know if you've heard stories about that, but it was kind of the first time where it was really made public that, yeah, Wisconsin does not have this. And ultimately it went back on the healthcare providers. Okay. So, the idea is, I'm just curious where everyone is at. So just a show of hands, how many of you have had any experience at all with doing advanced directives with a loved one? So not necessarily you, but someone else in your family. So just, can we give a show of hands, or you can do the little waving with your. Okay. So next question is, how many of you, same thing, just kind of give me a wave. How many of you have already filled out the forms for yourself? Okay. Nice. Okay, here's my third question, and you don't have to admit this. How many of you have the forms, but you haven't filled them out completely? You got them, they're somewhere in a drawer, but we just haven't got to that yet. Okay, so generally we all fall into one of the three categories, or maybe you haven't even started, but just this idea that, yeah, we're all at different stages, and that's okay, but hopefully everybody will get something out of today, and you'll be able to go back and kind of wherever you are. So it's okay no matter where you're starting, and that's fine. So the first thing we're going to talk about today is and I'm going to give a few definitions of all of these things. So bear with me as we kind of define what they are. The first one is a living will. So in Wisconsin, the living will is defined as, again, like I said before, it's sometimes known as the Declaration to Healthcare Professionals. But it's the way to select the kind of life-sustaining care that you want if an injury or illness leaves you in a terminal condition. So this is either dying or a vegetative state with no hope of recovery, right? So it's one of those, again, you have to be in a certain place for it to come into play. And we'll talk about that with most of the things today. So it's not like they can be enacted, right away. It's when you are deemed incapacitated with that no hope of return. So the next one is this idea of a power of attorney for healthcare. So again, let's define that. In Wisconsin, the power of attorney for healthcare is when you appoint someone to be your agent. And there's other terms that are used for agent as well. But this is a person that will make all of your healthcare decisions, not just those involving life support for you. Again, if you lose the ability to make decisions for yourself. And remember, those are the key words here. When you lose the ability to make decisions for yourself. So in Wisconsin, I'm going to refer you quite a few times today to the Department of Health Services, the DHS site. They have all of these materials on hand. They also have several really good materials that kind of put everything into place. One of them is called Your Right to Direct Your Future Healthcare Needs. And who will make your medical decisions when you can't. So again, this is very specific to the state of Wisconsin, and it puts it in very easy to understand terms, and you can just kind of go through step by step, and it makes it really easy to understand. The third one that, like I said, Wisconsin recognizes in that deem of advanced directives is the power of attorney for finance and property. So what this does is it authorizes someone else, again, often returned as an agent, to make your decisions concerning your property for you. That agent will be able to make decisions and act with respect to your property, including your money, again, whether or not you're able to act for yourself. So a key point to remember when we're talking about power of attorney for finance is that it does not have to be the same person as your power of attorney for healthcare. So we'll talk about that again in a little bit, who qualifies for that, and then also making those decisions. One of the things that is really important to keep in mind when it does come to determining who your agent is that there are specific rules in Wisconsin around, again, who can be it, and then what happens as life, happens. So one of the specific things is, if you name your spouse or a domestic partner as an agent, and that ends. So the marriage or that partnership is terminated. So let's say you got an annulment or you're divorced, then it's really important to know that the document becomes invalid, right? So unless there's special instructions that it remains the same person, and the state says it automatically becomes null and void. So it's important, and we'll talk about this a little bit later too, that we do go back and make sure that we can adapt it and that it is still valid, because you don't want it to be invalid because you named someone that is not able to do it. The one thing I hear a lot about, specifically about this one and naming that, especially the spouse or significant other, is a lot of times after people, even after they separate or divorce, they still want that person, right? They're still the trusted person in their life. And that's okay, but you would still have to fill out a new form, and then that person gets named. Okay, So some of the other things that you might want to look into, one of them is a DNR. So again, since I am using legal terms and these are legal forms in the state of Wisconsin, it's important to note that the definitions that I'm giving you today are coming right out of the Wisconsin state statutes, right? So I told you I was going to mention this. So again, with that DNR, it's right in the Wisconsin state statute. It's 154. It says that, a do not resuscitate order directs emergency medical technicians, first responders, and emergency healthcare facilities, all personnel not to attempt, very specifically, cardiopulmonary resuscitation on the person for whom the order is issued, if that person suffers a cardiac or respiratory arrest. So it's not saying they can't do other things. It's very specific to performing CPR and trying to resuscitate them if they do go into cardiac arrest. So the purpose of a DNR is to ensure that all medical care, all the providers and everyone who provides that medical care, so whether this is in the emergency department or again in an out of hospital setting, make sure it's very consistent information is shared and that the patient's desire is carried out, right? So again, I'm going to go back to that DHS site in Wisconsin. If you do go to the DHS DNR site, it gives you the forms for filling out a DNR. It is very specifically just one page, and then the back side is the restrictions. So it literally only is about 5 lines. It's very, very short. It's one of the shorter ones. There's also instructions on how to revoke a DNR order, and we'll talk about that a little bit later today. It's kind of, I won't say giggle, but when we look at the code, when it talks about canceling these materials, it very specifically says that you can tear them up, you can throw them away, you can burn them. Like, wow, someone's burning their papers, but you can do lots of things to terminate them, and that is okay. We'll talk about that a little bit more in depth in just a few minutes. But then there also is the order for a DNR bracelet. So that's on there, and other materials. So there are other things that you can get as well. Do know, and we'll talk about this, that having that bracelet or even sometimes a necklace is one of the safest ways for the emergency medical personnel to know that you are a DNR. So a lot of times I've heard people say or tell stories where they had one and it was just the paper and it was on file, but when the EMTs came to their house, they had no way of knowing that the person was. So that's why when healthcare providers share information with you on ordering DNR bracelets or necklace, because that is one way for the emergency personnel to see that and know, because they're not going to be able to pull up your medical file, right? Their job when you get, when they arrive at your home or when you get to the emergency room is to save you, right? That is what their job is. So if you want, if your wishes differ from that, please make sure you have it very visible. So that's why we do encourage, wearing, again, either a necklace or a bracelet so someone else can see that. Okay, so some other forms to consider. Again, and these are all legal forms. The first one is organ donation. So you can, again, it's totally a personal choice. If you want to choose to save and improve lives of others by donating your organs, you can do that. Most of the time when we renew our driver's licenses here in Wisconsin, that is something that you can you can designate on there. And it's something that, no matter what your age or regardless of your health history, that you can do. So I will say this is probably the most common question that I get around advanced directives is when they get to this organ donation. The most common response I get is, I'm too old. No one's going to want my old and decrepit organs, right? And that is just not the case. So if you don't know much about organ donation, they can pretty much use anything on our bodies. And depending what your health history is, there might be things that they will not be able to use, but more than likely there is something that they can use. And if you haven't filled out this form yet, it is very specific and it allows you to check the different pieces. So I do encourage you to look into that if that's something that is of interest to you. The next one is HIPAA. And you've probably heard of HIPAA because when we again go to any healthcare provider, they're going to ask you the questions. But really, it's this idea that it's a federal health insurance. It stands for Health Insurance Portability and Accountability Act. And this was in the early 90s. But the idea is that it gives you protection around your privacy rights. And it allows you to safeguard your health information. So it's really important to know that you have this and you have the right to access your health information. So if you want copies of your records or different pieces, you have the ability to access that. It also gives you the ability to correct or amend any of your health information. And it also allows you to file a complaint. So most people know it exists, but they're not necessarily sure that they do have those three components that it does give you. The next one is something called a POLST. And a POLST stands for Physician's Orders for Life-Sustaining Treatment. This is becoming newer in the state of Wisconsin. Some states, especially on the East Coast, it's very common, and most hospitals and health organizations do have these available. And it's fairly new in Wisconsin in the last 5 years. So there's only a handful of counties that have it right now. And they're primarily on the western side of the state. So if this is something that's of interest to you, I encourage you to reach out and ask your healthcare provider if they do have POLSTs. So what is it, right? So I've been talking about it. It is another form that the doctors can order for you, and it helps you control all medical care at the end of life. So it's similar to a do not resuscitate, to that DNR. The form tells emergency professionals and other healthcare providers whether or not to administer CPR. So that's where it's similar to the DNR. If you're having, again, that medical emergency. But it also gives other information about your wishes for end of life care. So again, check with your medical facility to see if they do have POLSTs and kind of keep updating that to see if it is available. So again, a little bit of a difference between the DNR and the POLST is that, excuse me, the DNR is specific to emergency personnel, so the EMS providers, and it's specifically around that CPR, whereas the POLST might include the DNR, but then it also will give additional information on additional medical interventions that you might want or not want. So it takes it one step further beyond just CPR. And the last one that you might want to consider filling out is the authorization for final disposition. So when this is properly filled out and signed, and you're going to hear me say this quite a few times today, in the presence of two competent adult witnesses or a notary, this document allows you to share your wishes about designated someone else, again, who is another competent adult or representative, to make your funeral arrangements on your behalf if you are, again, if that wasn't shared or you didn't get a chance to share that. So it's just one more form that we do have. Okay, so let's dive into how, what are the steps? So like I said, maybe you already have these, maybe you fill them out, and maybe they're just kind of sitting aside and you haven't gotten to them yet. What are kind of the steps that you would take? So, you know, we usually encourage you to start with a living will. And again, that power of attorney for healthcare. You can get both of these forms, again, from the Wisconsin Department of Health Services. They are free. The cool thing in Wisconsin is you can order up to 100 copies of this. You might ask, why would I want 100 copies? One of them is, you know, we do encourage you to share this with multiple places. The other thing is, I've heard, again, more recently in the last couple of years, is families are doing this together, right? So as long as you're having these conversations with your, you know, family, friends, loved ones about what do they want, it gives them the opportunity to share with you what they want as well. So again, we encourage these forms to be filled out from 18 all the way up. So it's, you know, a lot of times people are going, oh, I don't want to do it at a holiday. But sometimes when you have family gathered and everybody is there and you have, you know, everybody is provided the opportunity to have the forms, you can fill them out together and have a really good heartfelt discussion about what everyone's wishes are, right? So it's one of those things that as long as you're having a conversation about yourself, it allows them to share what their wishes are at the same time. Um, Again, you can get the forms from the DHS site, and we'll share that with you later. Um, I will also say, if anyone needs things, or again, you have family, friends, or loved ones that would like it in a different language, Wisconsin does have them not only in English, but in Hmong, Spanish, and Vietnamese. And we also, there are some federal ones, sites that can get them in additional languages if you need additional languages as well. Okay. So number two is thinking, who do you want to be your healthcare agent? So again, as I said earlier, this person does not have to be the same person as your power of attorney for finance, but this person does need to be someone that you trust, right? And someone not only, that you trust, but someone that you believe will carry out your wishes. So this really is an in-depth, you got to think on this for a while. Have some conversations with your loved ones, share what your wishes are and see what their response is. I've heard people, over the years say, well, it's my oldest. That's their duty. It automatically goes to the oldest child, right? And that just doesn't hold true anymore because your oldest child, maybe, they live in California and they're not around and they're not aware. And maybe your oldest just doesn't feel comfortable and would not be able to follow through on your wishes. Maybe they have different beliefs. Maybe they have different religious or cultural beliefs than you do. And they, really cannot do it. So it's important. And maybe it's not even a family member. Maybe it's a friend because all of your family members are, really emotionally tied to you and they don't feel comfortable carrying out your wishes. So it's really thinking through first, what do you want? And then who do you feel would really be willing to carry out these decisions when the time comes? And so it takes a little bit of thought. It does take conversations. It does take, really going in depth with this and making sure that the other person is okay with it. So this isn't a, spur of the moment, I'm just going to drop this on you kind of thing. It does take some thought. And also remember the very first thing I said today was, grace, right? So make sure as you're having these conversations, and maybe you had someone in mind, you really wanted it to be, this child, or you really wanted it to be your spouse or your best friend. And when you have these conversations, you find out that no, they're not comfortable. And they wouldn't, they wouldn't be able to follow through. Again, this is where that grace comes in that I mentioned earlier. And that's okay, because no, everybody is coming in from a different place. We all have different experiences throughout our lives, and we need to be okay with that. And so that's why really having conversations about this is really important versus I've heard of, and I've actually seen this in my own life, where someone fills out the information, puts it in a manila envelope and goes, here, sign it. And that's really not the way to handle this. Just because again, you need to be able to make sure they are comfortable with it. And so it is really having a conversation, not necessarily just sharing it with someone. So the third step is, and this is really important, and to make sure that it actually is valid in the state of Wisconsin, is they do need to be signed and witnessed. So for most of these forms, again, this is to make them legal in the state of Wisconsin. They do need 2 witnesses. And those witnesses, there's some pretty specifics around who cannot witness your documents. So they must be 18 years of age. They cannot be related to you in any capacity. So this means by blood, by marriage, by domestic partnership, excuse me, adoption. And they also cannot be directly financially responsible for your healthcare. So if they're paying your medical bills, they do not qualify either. The witness cannot be a healthcare provider who is serving you at the time when you're filling out these forms. And it also cannot be an employee of that facility unless, there's 2 exceptions, unless it is a chaplain or the social worker. So those 2 people are designated to be able to witness. Otherwise, no one else can. Again, a witness cannot be an employee of an inpatient healthcare facility, so like a long-term care facility where you are a patient. And again, the only two exceptions are that chaplain or a social worker. A witness cannot be, again, a healthcare agent or get any claim on your estate. So it's really important if we follow these rules, that's a valid witness. So that makes them valid if we follow the rules, that they're acting in good faith, and that protects them from any both civil and criminal liability. So that's why it's really important that we follow the stipulations that are designed to set up who can and cannot be a witness, so that something cannot come back on them later, and they do have those legal protections. And this is where it comes into play, like I said earlier, when we were talking about that POA for finance, that making sure as your life changes, so let's say you have a divorce or there's a death, different pieces, that it is still someone who is legally able to be a witness. Recently, in the last couple of months, I was working with a family, and they did decide to do this as a family. So it was a woman who, early 60s, two adult grown daughters with their own families in their mid 30s. And they, got all the papers, filled them out together, and had the neighbors across the street, a husband and wife, not related in any capacity, but they trusted the neighbors. They came over and they were the witnesses. So everybody was able to share it, have a conversation at the same time, and then the non-related neighbors across the street were able to witness everybody's. So, I encourage you to get a little creative with who your witnesses are. And I'm sure we all have people in our life, whether it is friends or whether it is maybe a church or different social groups that you go to or belong to, that you can ask, would they be willing to be a witness? One of the questions I get often about this is, I go to an attorney and can I fill these forms out with an attorney? And the answer is yes, but it's also a no, you do not have to, right? So I've mentioned many times today that the forms are available from the Department of Health Services website in Wisconsin, and those are the legal forms. So as long as they are witnessed correctly and signed, they are legal. You do not have to go through an attorney. So if you have an attorney for your other estate materials, so maybe you have a will or you have other pieces, that is fine to use it, but it is not required. The reason I bring it up here is because some people say they want maybe the attorney and a staff member to be the witness. And some firms have staff on hand that will do that for you. They will witness. So that is a benefit if you don't have anyone in your life that you feel comfortable to ask to be a witness. They can do that for you. But again, no, it's not required. You can do this yourself without having to have an attorney. The final step, and I've said this many times already, is to communicate your wishes, right? So do not assume that your provider will share the information. So this is one of those topics that sometimes people, they just, for whatever reason, maybe it's what I said in the very beginning, they're really uncomfortable and they don't want to have the conversation. And they assume, well, I filed it, with my healthcare system, and they'll tell whoever when the time comes. Don't go there. So again, emotions are going to be really high, and it is important that you make sure that you share it with your loved ones, and then also all of your providers, right? So I don't know how it is where everybody is at, but I will say in central Wisconsin, we have several very large healthcare systems, and we also have private places. So I might have a doctor with one institution. I might go to a hospital with another institution, and maybe I go to, cardiovascular associates specifically for my heart, right? So I could have three separate institutions that do not electronically communicate. So if I filed it with my regular physician, it's not necessarily going to go to the hospital or to my heart specialist, right? So it's really important that you disseminate these materials to all of your providers so they have it, and do not assume that they're going to do that for you. So maybe if you are working, it depends on your situation, especially ends of life. You might have a hospice specialist that you're working with, or a social worker, and they might say, I'm willing to send this to everybody for you, but do not assume that anyone is going to do it for you. And as I said, many times, it's really important that you have these conversations with your family, friends, and loved ones, and make sure you share what your wishes are. I will again mention just real quick before we go on that hopefully you've been offered these materials at some point. So your healthcare systems, so your doctor's office, the hospitals, some law firms will have it. Or like I said, you can also get them just straight off the DHS site. Or even, like I said, nursing homes, a lot of them will provide them. So you should not have any difficulty finding any of these forms. And I will also say they're very simple. So I'm not sure about, in the very beginning, I asked how many of you have already filled them out, but if you found them complicated, but they really, especially here in Wisconsin, have made them very easy to fill out. So it literally is line by line, and it's just a check mark, and then you fill in. So if you, again, have thought of these pieces beforehand, it really should be a fairly simple process to fill them out. They're not extremely complicated. So what should we consider before we fill out the forms? So let's spend a little bit of time talking about what decisions are actually on these forms and are actually included in the different pieces of advanced directives. So the first one is, like I said, that DNR and a pulse very specifically talk about CPR. So when you're filling out on the different forms, we really need to consider, do you want CPR if your heart stops? Do you want to be put on a machine that pumps oxygen and air into your lungs? Do you want to be fed through a tube? Or do you want to have, again, a tube breathing for you if you cannot breathe on your own? So do know that, again, these are tough decisions. They're more than likely going to take you some contemplation. So really spend some time thinking about it. Try to think through different scenarios. If it's again, I'm going to use that a big C word, COVID this year really brought this to surface, right? So a lot of people may have not thought about it before, and they might have said, oh yeah, no, I definitely don't want that, right? And then all of a sudden COVID happened, and it was like within a day, a loved one's in the hospital, and you're like, yeah, I'm not ready for them to go yet. Like, yes, I want them to go on a respirator. So try to think through different scenarios in your head. And it really is, we don't know, right? No one knows when the time comes. It could be, today I get in a car accident and someone has to make this decision. So really think through what some of the different scenarios would be, and would you want any of these pieces when the time comes? And again, have conversations. And one of the reasons I keep saying have conversations is a lot of times we're very narrow-minded. We're thinking like one thing. And then having the conversation out loud with someone else, you go, well, what about this? What if this happens? Or what if this happens? And so they kind of bring up different scenarios, and you're able to go, oh yeah, no, I guess I wouldn't want it then. Or, oh yeah, no, I still feel this way. I still say no. And so it really is important a lot of times. We can have these conversations in our own head with ourselves, but to verbally discuss them with others helps you think through all of the scenarios, because there are so many ways that this can go. And you have to think about different perspectives when you are making these decisions. Other things to consider. Do you want a machine that cleans your blood? If your kidneys stop working, do you want to be again fed or get fluids through a tube if you cannot eat or drink? Do you want any medications if you have a serious infection? Again, so keep in mind that most of these do not come into play. That key word that I said in the very beginning, that phrase of if you are incapacitated and unable to make the decisions for yourself. So it's not that the other person or whoever you designate is able to do these things willy-nilly. It really is when you are unable to do this. So that's why it's important to think through them and have it written down. So a lot of times, even when we have the conversations, You might tell someone, a loved one or family or friend, what your wishes are. But then actually, when it comes down to it, when the time comes, how do you think they're going to be feeling? Emotions are going to be really high, right? And I don't know, I asked in the beginning if anyone had experienced this with a loved one, but we're not thinking clearly, right? No one is thinking clearly. Emotions are really, really high, and we're not going to remember that conversation that was had. And I can speak to this one from personal experience. My stepmother had breast cancer, and she did end up dying by breast cancer. But over the course of her illness, we had had these conversations. We did not write them down. She did not want to write them down. She felt just telling people that it would be okay. And when the time came, and it wasn't a surprise, folks, we knew it was coming. She fought a long battle, but we didn't remember all of the details. I didn't remember very specifically what machines she did and did not want. I didn't remember different pieces. And so really important to make sure that we do, and we did, and I again, I'm part of, I'll own it, part of my own, oh yes, we're gonna, and we did it. So again, the forms are very easy. It's just a check mark, but it also helps others remember when their emotions are really high and they're unable to make these decisions. Okay, so one of the most common questions I get is, well, what if I change my mind? And this happened again a lot this year with COVID, right? Because it was something we hadn't thought of before. And it put new experiences into our heads. So you do have the ability to change or cancel your advance directive at any time, any point you can. You can just fill out the new forms, get rid of your existing forms. Keep in mind that if you do change or create a new form, give everybody a new copy. So again, all your healthcare providers, and again, share with your family and friends. It's important not to just cross out the information unless it's something like only to change your address or your phone number. In Wisconsin, again, make sure that you do have the witnesses and the witnesses are still valid. And also make sure that your witnesses or the people that you designate in there are aware if you do make any changes. So as with all of your estate planning documents, that advance directive really should be updated on a regular basis. So they're not meant as a, set it and forget it. It's not necessarily a one-time thing because again, life happens and our minds might change about different pieces. So we recommend that everyone follow this kind of rule of thumb for updating their advance directives. We call it the 6 Ds, right? So the first one is a decade. So, at every 10th birthday year, so, 40, 50, 60, 70, 80, 90, just pull it back out and see if there are any changes. There might not be, but again, just look at it. The second one is death. If there's been a death in your family or in your support system, you might have to change it because it might be someone that you had designated, or it might have been even someone who had witnessed it. The third one is a new diagnosis. So if you get a serious medical problem, or for you, or again, someone that you named as your agent, it might change the materials on your advance directives. The fourth one is divorce. So I talked about this already. If your spouse was named as an agent on your directive, the state of Wisconsin says, nope, it automatically is considered null and void, the whole document. So do make sure that you fill out a new one, and you can still name them, but they'll look at where you married at the time. So important that you don't, and I have heard, we'll call them horror stories, but bad experiences from folks that said this did happen. And some of the examples were they had someone named or people were witnessed when they were dating, and then later they ended up marrying the person, so then it did become invalid. They were not able to be the witness. And so even though they were not married at the time, when they did become married, they did become invalid. And so the whole document was invalid. So you don't want that to happen. So make sure you do keep that in mind. The fifth one is decline. So if you or your healthcare agents decline rapidly or use function, you might want to go back and look at your materials again. And the last one is domicile. So if there's change in your living situation, if you move or someone moves in with you, if your housing changes, that's another time to go back and look at those materials. So I said many times, most of this information can be obtained at the DHS site. So actually, here's the link, but you also can just Google DHS Wisconsin Advanced Directives, and it'll take you right to it. So it's really important. And then they also have the guide that I mentioned, the guide to end of life planning. And that is also very specific to Wisconsin, and it makes some legal forms. So I'm going to pause there for questions.
And Miss Jackie, we actually have a few in the chat if we want to go through those first.
Yep.
First one is, do you have any suggestions of people to designate on forms if you have no living relatives or close friends?
Yeah, absolutely. So I think, a lot of times the first one, people, you do look in within your circle, right? So is there someone, that from church or someone else that you trust, might not be considered a close friend, but you would still be able to have that conversation with you? I know some, faith-based organizations will have that. That's something that they offer for those that they know do not have loved ones and close friends. And then if not, like I said, legal services do provide that as well. So you can, an attorney will fill that form for you if that is necessary or needed. So you can designate that is something they offer as well. So, but think through your circle, and it might not be someone that's close, but like I said, a lot of different faith-based organizations provide that for people within their community.
Great, thank you. Also, when witnessing a power of attorney, can the notary also be your witness? And the notary is a family friend.
Yes. So that's a complicated question. So yes, yes, and yes. So in Wisconsin, you can or may use a notary. You are not required to use a notary. So that is one of those that sometimes people think they have to. You do not have to in the state of Wisconsin to make it legal, but you can do it. So especially that's one of those, again, if you do not have a close family friend or loved one, a notary is someone that you can do. But again, notice you need two witnesses. So sometimes I have heard people going to their financial institution and they have a notary at their financial institution. And then someone else, another staff member there is willing to also be a witness. So that's another one that you can do is check with your financial institution to see if that's something that they provide.
Thank you for that. We're going a little more emotional with this next one and having an absolute fear of death. We're afraid to die. So how do we make a decision about a DNR?
Yeah, that's a really good question. So I think one of the things is, again, really having conversations with your family, friends, and loved ones. And so part of this is just really thinking about quality of life. And it's probably going to change for you, right? So I don't know about you, but where I was thinking when I was 20, it was different than 40. Different from 50. I'm probably going to be different when I'm 80, right? Because, and it might be who's still with you, right? Your spouse or your loved ones or wherever you're at. But having conversations with others about, again, the quality of life and, where are you comfortable with where you're at really will help you kind of make that decision. And the other part of it is if you really don't want to, if you don't fill out the forms, who makes the decision? Medical providers. So then it will not go to your family in Wisconsin. It does go to your medical providers. So if you do not feel comfortable, you do not have strong decisions one way or another, your medical providers will make that decision for you. So you are able to, you don't have to do this. So if you don't want to, it does go then onto your physician and your medical team. So, often it'll include others, the social worker and different pieces will be included as well.
And then where should the original copies go?
So that's a great question too. So you can keep the original, and then again, make sure that copies do go to your healthcare systems. Some systems might ask for the original, but it really doesn't make a difference. So most people keep the original, give copies to those that are designated on the forms, and then into their systems. Most systems are electronic now, so it doesn't even have to be the original because it's a digital copy anyway.
Thank you. Okay, oh, do you have
No,
another thing?
Nope, I just thought of something I forgot. So finish with questions and then I'll share.
Okay, well, this might be a couple parter here.
Okay.
Someone's a little unclear on the differences between living will versus power of attorney for healthcare. What do we need to know?
Yeah, so it's really about, so again, when you get into the forms and you start filling them out, they're very, very specific. And it literally is just a check this, check this. So if you're confused about any of them, print them out. They're not, it's not like it's 40 pages. So most of them are, like 2 pages, 6 pages. They're very condensed. Again, Wisconsin, I think has done a really nice job of making them very short, sweet, and very easy to understand. But it just takes you through like each one. But part of it is really, again, deciding when you want someone else to step in and make those decisions for you, right? So they all designate when you're incapacitated, but are there additional pieces that go into it? So like I said, when we're just very specific with just the DNR, but then are there other things? So it really includes what's included, and all the things that I mentioned today are in there, but it's how much do you want to designate, right? So the more specific you want to be, the more that you can designate. If you want to just say something as simple as, yeah, I don't want CPR, or I don't want to be put on a respirator, then you can just leave it at that. So it really is about how many decisions you want to make, and what you want included is the in-depth that you go. Does that make sense? The other thing is that a lot of these terms are used interchangeably. And so you might be talking about a living will, might be talking about a power of attorney, might just say advanced directive. So the best way is to just print out the forms, and then see what do you want, and what decisions do you want to make. Because a lot of times even providers use different terms. Just get the forms, fill them out, and fill them out to the capacity of what you want to make those decisions. Does that make sense?
Absolutely.
One thing that I did not say, that I have seen come up, when I was talking, I reminded myself, when I was talking about checking with your religious institutions. So whatever your faith is, I know everyone has different faiths, but checking with them to see if they have any specific things that might shape what your decisions are. So one example of that is in the state of Wisconsin, there is a specific form called the Catholic Addendum to the Wisconsin Power of Attorney for Healthcare. And so it very specifically says what the church does suggest and not suggest. And a lot of times we don't even know that. We're not even aware of what they are. So this again is available on the Wisconsin site, on the DHS, and that is something that you can pull out. And it is legal and it makes it legally binding. So it's very specific about what the church does allow and does not allow. So, and it still has the same witnesses. It's still legal, so it's a legal binding document. But again, just allows for the things that they might not recommend. So if that is something, no matter what anyone's faith is, but if you do have faith, make sure you do check with them to see if there's anything. And then again, make sure that the forms that they have are still, again, the legal binding documents in the state of Wisconsin, because you don't want them to be considered invalid.
Thank you. Another couple questions. So when is a power of attorney for finance activated? For healthcare, you have to have two doctors, check off and make sure that everything's on the up and up. But does that mean if we can make our own financial decisions right now, we should not fill one out, or should we fill one out?
Yeah, that's a really good question. So the power of attorney for finance is slightly different, but it does need to be activated as well. So it's, again, I encourage you to, again, have conversations and make the decisions, but it does not come into play until, again, you're deemed unable to make those decisions. It's different than the POA for healthcare, because the POA for healthcare is designated when you're, the word term incapacitated is a little bit different, right? So someone can be very healthy, but not able to make good decisions, where POA for finance would be. So I'm going to call into play. There's some like around maybe mental health, different where you're not fully incapacity. So it makes a little bit of a difference. So yeah, check with that one and look into that. And again, that's one of the ones that you can ask both an attorney or again, even at your financial institution. They'll have people that specialize in that and be able to. The other one that I haven't mentioned today is we're very blessed in the state of Wisconsin to have the Aging and Disability Resource Centers throughout the state. And they also have individuals that will help you fill out these forms, answer all of these questions for you, and they are free of charge. So if you are curious, please contact your Aging and Disability Resource Center and say, you know what, I'm really confused about which form. I'm not sure which form to fill out. I don't know when it comes into play. Can someone sit down and go through these forms with me? And they do. They will have someone that will sit down and go through it with you. And again, there's no cost to do that. And sometimes your senior centers have those as well. And a lot of times, I'm just going to keep going, your healthcare providers have that as well. So I know just in the last, I'd say 6 months, and again, a lot of this is spurred by COVID, but a lot of the health systems, the social workers are saying, yeah, absolutely. If you have questions about this, please reach out and ask us. And we will answer any of your questions because they too, that's their job, right? So when the social worker, when it comes to this time when you are incapacitated and cannot make decisions, they want these forms filled out because they don't want to have to guess. They don't want to have to start having conversations with your family. The more that they can carry out your wishes, the better. So they're willing to work with you in advance to make sure that you have the forms filled out. So yeah, absolutely. So no matter where you are, I think in Wisconsin, we have a lot of resources available to us that will help you answer these questions and make sure that you get them filled out as much as possible.
Great, thank you. Now I know it is 10:01 and some of you have hot dates and going to breakfast and early lunch and all of the things. So if you do need to take off, we did put the evaluation in the chat. If you would kindly fill that out. It's anonymous. We won't know who you are. It will just help us with our programming. Otherwise, Jackie, do you have a little bit of time for a couple more questions?
Yeah, absolutely. And I was also going to say this. So I don't know about you guys, but I'm someone that processes after, right? So I'm laying in bed at night and I'm thinking, oh, I should have asked this, or what about this? Because this is one of those things, like I said, it's complicated, right? These are things we probably have not thought about before. We're not rolling around, every day going, do I want to be on a respirator? We don't think about the stuff. So I will hop on early next week. So if you have questions, we'll make sure we do pop on a little bit early next week. We'll open it up probably about 1:45, and I will be on and answer any questions. You also can email Sarah or any of the rest of us, and she will forward those to me, and I will also answer questions that way too. So if you don't feel comfortable sharing them with the group today, you can email us and we will respond that way as well. So either one, so we can do it next week or email as well.
Thank you, Jackie. So before I forget the next one, often hear the term durable power of attorney. Do we have those in Wisconsin? What's up with them?
That's a really good question. And I think it's the same. I'll look at that one up and we'll get back to you on that one.
Excellent. Could you please repeat the next of kin statement in Wisconsin?
Yeah, like who it can and cannot be.
Yeah, what's it all about?
Yeah. So, well, let me clarify that. So are you asking like who cannot?
I think who cannot. The question was repeat next of kin statement in Wisconsin. What is that about?
Okay. So I think if you're asking about that Wisconsin is not a next of kin state, meaning that in many states throughout the country, if you do not have these papers filled out, they will ask your spouse they will ask your children to make these decisions for you. Wisconsin does not have that. So what that means in the state of Wisconsin is that if you do not have the forms filled out, your medical team is the first to be able to make your decision. That's who they go to. So the doctor, so again, I'm going to use the COVID example. I heard many, many bad stories in the last 2 years of families that were extremely upset that the medical team made the decision on whether to put someone on a respirator or not, and that the spouse or that the family was not able to make that decision. That's the next of kin. That's what we're not a next of kin state. So many states do have that. They do allow that. And again, I know there's caveats to this. I know some medical institutions will ask the family. And again, a lot of the social workers will say, no, we do. We try to the best of our ability. But no, that legally they don't have to. So that's when we say we are not a next of kin state, as legally the physician is the ultimate one to make the decision. If you do not have the forms on file with that institution, the medical team is the one who gets to make the decision, not the spouse, not the children. Does that answer the question?
I think so. And Marilyn, if you're still on, we can clarify anything with that. Another couple more questions. Before this presentation, I thought there were 4 distinctly separate things: advanced directives, power of attorney healthcare, power of attorney finance, and a living will. My understanding now is that you're saying that advanced directive is more of a general term and not its own specific document. Is that making sense?
Yeah, absolutely. So the term advanced directives, again, in Wisconsin, they do separate them into the 3. And then again, the additional forms like the DNR are part of an advanced directive package. Let's put it that way. Yeah, so that advanced directive is a generic term that includes or encompasses the different components. And again, that's Wisconsin. So do know that other states may have other pieces that are a part of it. And like I said, there's different forms like the DNR or Pulse that you may or may not include, but they're not necessarily under that.
Excellent. And then the last one is really just a comment, and it goes a little bit along with what you were saying about our faith institutions and sometimes nonprofits and our ADRCs. But the Wisconsin Medical Society form also has areas for your end-of-life preferences. For example, comfort preferences, messages to family, friends, special instructions, which I'm going to guess are very important also to write down, aren't they?
Yeah, absolutely. So that brings up a really good point of if you're having these conversations, you might want to take it one step further and have the conversation, right? And sometimes it's not even one thing. So I mentioned earlier that a lot of, I'll suggest when your family gets together, have some of these conversations. And it might be just something as simple as, have you filled out the forms? Have you thought about it? What would happen if you were in a car accident today? And sometimes when you preface it that way, like it can happen to anybody. We're not just talking about me, passing away because I'm 85. We're talking about anything can happen to anyone at any time. But yeah, are there things to, you might ask about, how I do feel very strongly, do you want to be cremated or do you want to be buried? Is there a place that you want to be buried? Have you already taken care of that? So a lot of times families they've already paid for a spot, or they've already prepaid for their funeral and they haven't mentioned it because they don't want to talk about it. So, family members don't even know that's already been paid for, or a spot has been, or feel very, very strongly. I've heard stories about, maybe a spouse that died 40, 50 years ago. And, the spouse's name went on the stone, but now they don't want to be buried there. They want to be buried someplace else, or with a second or a third spouse, that kind of thing. So it's, have these conversations. And sometimes it's very nice once you start it, just to let it all come out. And maybe it's, we do 1 or 2 questions every holiday, right? As you have everybody together, and that way you're able to track what's that you did. But yeah, so the form that you mentioned, there's also one from the state bar, Wisconsin. I'm assuming it's very similar to the one that you mentioned. And then there's also, like I said, the planning materials are on the DHS site, and they also ask all those additional things. So there's some really nice materials on there that'll take you through additional questions that you can ask besides just the healthcare piece.
I'm muted. One last question, Jackie. If I live in two different states in retirement, do I need forms to cover both states?
Yeah, so we get this question a lot, and the answer is maybe. So they are legally binding. So let's say you fill out, Wisconsin is your primary home. You fill out the forms here. You take them along. It's not guaranteed that where you're going has to abide by them. Most states do. Most states will. So that's kind of the generic answer of most may or will, but it's not, because they're legally binding documents, that's not necessarily true. So if you have an established healthcare provider in another state, ask or request the forms from them. Or again, most of them are available for free online. And you can get, through there too. But yeah, definitely make sure that you have them and you can share them with that to make sure that you're safe, right? Because it's not a guarantee.
Awesome, Jackie, thank you. And just a couple points of reference. Karen, who's our amazing educator in Outagamie County, mentioned on April 12th, the Outagamie Caregiver Coalition is sponsoring workshops because it is going to be National Healthcare Decision Day that day. So you may have some things in your counties. Some of your extension offices may have some different opportunities to assist. There's also a mention of a neat card game called Go Wish that you can do yourself online and order the actual cards. It's based on your values and helps with communication around your wishes. So, frankly, in my family, I know if we make things a game, it's a better discussion. So maybe that's what we can do for Thanksgiving when we can finally get together for those things, right? And have some fruitful discussions. But otherwise, folks, it is a little after 10. Thank you so much for sticking with us. I'm going to stop the recording